sagging buttocks or droopy buttocks. What does that actually mean? What does it entail? And what are the causes? Why does that happen? And what can we theoretically do about it? That's our daily in and out in a very busy body contouring practice. And yeah, of course, why do buttocks sag? Probably primarily because of gravity, but why much more in one than the other? I think probably the single best guess is genetics. It depends on what your parents give you on the way, your skin quality, your muscle tone, your build. But there's things that we can influence with our lifestyle, and quite so. And I think the most drastic one, and currently with the fat loss jabs like Ozempic, Mounjaro, we go with these things. What we see most is sudden weight changes. That's become a big issue, the so-called Ozempic butt, which can stretch skin and reduce elasticity. Aging, of course, changes in collagen quantity and composition will contribute. I always try to be realistic with patients. Exercise usually doesn't really grow your buttock or make it look much better, but not doing exercise can make it look worse. That's the unfair truth. So we do differentiate between those who just lose muscle tone, have lax skin, or skin depletion by loss of fat, or a mixed pattern of all of them together. That's basically a very simplistic illustration. So you look at a top heavy buttock with no sagging, and that goes from 1 to stage 4, and 4 is when they've got like a skin flap hanging over the infragluteal fold, the fold beneath the butt. That would be then really a sagging butt. And depending on this amount of skin laxity, we decide what best to do, what to recommend, what our options are. You see here one core example, where you have like these two things together, volume depletion of the buttock, a kind of inverted shape of fat axis on the upper half, and then by fat redistribution you get a very nice reshaping result. Now, what can exercise contribute? Now, I don't want to be misunderstood. I do encourage all of my patients to sport as exercise. It's good for your mind, it's good for your soul, it's good for your body, but please, it will not really grow your butt to a significant degree, and let alone lift a sagging skin envelope. I think this is this is just how patients grow their own frustration. Because if you approach it with this mindset, you come to a point where you get frustrated and you give up, and then you don't do it anymore. Although it's a good thing, but again, it's excellent for your health, it's excellent for your mind, it's excellent for your body, but it will not really reshape your butt. So it can keep muscle tone, so by all means do it. What can reshape your butt? I'm running down surgical options. I will, for the sake of briefness here, abstain from non-surgical options. The first one is a so-called Brazilian butt lift. The Brazilian butt lift basically is a redistribution of fat. You see the young lady here, she's had a Brazilian butt lift. What I did, we sucked out the fat from her waist belt area, from the love handles, from the lower tummy, from the upper back, and we transferred it into the buttock. So she gets roundness and hourglass shape. For the sake of completeness here, this young lady also had rib remodeling, so that is something that significantly dramatizes the effect of this surgery. But that gives you a completely new shape, and that's what I would say in the vast majority of cases, always bearing in mind that individual variances apply, the number one solution for patients in a BMI range of 24 to 28, 29. So what are we doing? You do see here that's a cross-section illustration of the human buttock. The red tissue is the muscle, and then you have two layers of fat, the superficial layer, which is just under the skin, and the deep layer. And the deep layer is an expandable space, so you can transfer fat here with excellent take rate. So fat transfer in that area works very well. It doesn't work 100%, but probably 70+%, and that's a very, very good take. So this is where we can really get volume reshifting and augmentation to a certain degree. The second option is a so-called supercharged BBL. That is for patients with a BMI of less than, let's say, 23, who want a core projection. Also patients with a really, really flat buttock who want a perky butt, a projecting butt. You see the young lady here, she was in that situation. She didn't have too much fat to work with, but it's not that she didn't have nothing, she had. But she really, the highest point on her agenda was a nice roundish perky butt, and here implants are really your best card to play because it gives a fantastic core projection, as you can see here. So that's a very good option. And this is a patient photo. Maybe the angles are not perfect, but I think it's a super photo to demonstrate the actual talent of buttock implants, what they can do, what they can deliver is core projection, core perkiness. Fat is a bit of a softer material. It cannot create that amount of core projection, at least not in one session. Now let's go into what I would say is currently the hot topic in sagging butt treatment. That is patients with a significant amount of weight loss. I'm showing you an example here. This young lady, she lost roughly 25 to 30 kilograms. That's an enormous amount, and that is an amount where we usually say, okay, look, you probably need to cut out skin. That's an option. We do that too. If there is more than 35 kilos weight loss, then you might need a skin excision procedure, a so-called excisional butt lift. But there is a gray zone, and that's patients up to about 25, 30 kilos of weight loss and suitable skin. So what we do, you remember, I showed you the droopy buttock with that skin flap hanging down. You can't fill that skin flap with fat. That's technically a bit demanding technique. So under ultrasound control, we bring a layer of fat transplant into that layer, which fills out that droopy skin envelope. And that is something that can save patients, like the case I just showed you, a skin excision. Here's another example. Patient with again, the same amount, probably 25 plus kilo weight loss. And if you look especially at the side view, she's got this droopy skin there. So it's patients, you know, I usually say, look, we'll approach it this way. We try to avoid the scar. But of course, fat transfer in this area is always a bit variable, but it's a good option to take, because in case the patient is not happy, then you can still do for example, a skin wedge excision in the infragluteal fold later. And this is how we manage many weight loss patients after Ozempic, Mounjaro, Wegovy, whatever it is. So a good option for weight loss patients. Now you've done all this. How do you maintain your results? Is maintain, not obtain. Big difference. Once you've done it, I mean, exercise will not grow a butt or not shape a butt. That is what we do. But exercise maintains a result. That absolutely. Apart from a good, healthy, balanced exercise regime and of course a reasonable diet, avoid sudden weight changes. You know, that is, it's for your skin. It's a big difference if you drop 5 kilos over 6 months or in 6 days, because that leads to more loss of stability, good hydration, and you know, do all this stuff we tell you to do after surgery. But at the end of the day, you know, there's no one single card solution for everybody. In the end, it comes down to what's possible for you. It comes down to what your body is up to. So that is something that, of course, we determine on a per case basis. There's no one cut serves all. So you do see you can get for the suitable candidate very, very nice results, very nice reshaping outcomes with the right indication and the right surgery. But what we very much lobby for is, like all surgeries, I think, you know, that monospecialization, focusing on one procedure is the key to success. We do nothing else than buttock shaping, body contouring, and we've done this for 15 years. I've got 30 years complete surgical experience and 15 years just dedicated to that. And I think it applies to all surgical disciplines. Do one thing and then do it world class. Don't do 20 things at 20 different operations at medium level that serves your patients best. And in the end of the day, also your practice. So we are looking forward to hearing from you and having the possibility to assess your case.